Hello, this is Lisa Huening of The Shifting Path. I would like to welcome you to What I Wish I Knew. In this audio series, I am talking to people who have been or are in a caregiving role for their family member. Today, my guest is Tiffany Mathews. She will be sharing with us her experiences in caring for her grandmother and the importance of advocacy. Tiffany, welcome. I'm so happy you're here today.
Thank you for having me. I appreciate it.
So tell me your story and what you wish you knew.
Well, caring for my grandmother was a tough road for all of us. My mom was her main caregiver, and it was really tough to learn that she was as sick as she was. We hadn't known because many times when she would come home from a doctor's appointment, she'd say, oh, everything's fine, just a little of this and a little of that. Turns out that she became ill, very ill, after she went into surgery for a colon resection. Her health declined very rapidly after that. She had at least 10 hospital admissions within a year. And my mother had no idea that she was this ill. And being her main caregiver, she decided that she had to start going along to my grandmother's doctor's appointments and finding out really what was happening. She hadn't known because, again, my grandmother would come home and say, oh, everything's fine, little of this, little of that. You know, and we're thinking everything's fine when it wasn't. When my mother finally went to my grandmother's doctor's appointments, she found that there was protein in her urine, which was affecting her kidneys, and her blood pressure was through the roof. We had no idea. You know, the doctors changed her medications and warned her that her health was beginning to fail. But I believe there was a disconnect that prevented us from helping my grandmother, and we could have possibly saved her life. But looking back, now that's something we basically have to live with. We're not sure what we could have done, but we all think that we may have had a better chance had we known the information that we needed to know.
And it was difficult for you during that time, too, because your mother was working as well, correct?
Absolutely. She was working full-time, and her job wasn't very friendly about letting her escort my grandmother to doctor's appointments or hospital appointments, or when she had to be off because my grandmother was back in the hospital. They weren't very friendly at all, but my mother made it work somehow, and she would, do everything. She had done everything. She had to learn very quickly how the healthcare system worked, about what kinds of conditions my grandmother had, and what had to be done. And there were many nights that she would call me crying and say, I have no idea what to do. And being a social worker for as many years as I have been and a discharge planner in hospitals, I let her know these are the things you have to look for. These are the things that you need to work out. And I don't believe anyone should have to learn that information while they're in crisis. It's good to know beforehand.
I agree.
So learning to advocate for my grandmother on top of dealing with the conditions that she had was really rough for her. And it was it took a real physical and emotional toll on her. And I don't want to see that happen to people. It's very important to be able to advocate for the person you're caring for. And, in those down times, whenever they are, because all caregivers are busy, they should learn about the person they're caring for, their conditions, and what they need, and what kind of treatments are available. So they are prepared for appointments and that sort of thing.
You make a very good point. Understanding your loved one's condition and what the progression is going to look like helps you to better prepare and be organized about the types of things that your family member is going to need, even down the line. It may vary slightly, right? One person's chronic disease may look a little different than another's, but it's going to have a similar progression. And having that knowledge is huge in not, as you said, being in crisis mode all the time.
Right. If you're going 70 miles an hour all the time because you're either learning what to do or learning about their conditions or learning something that has to do with their care, you're going to burn out very, very quickly. And the problem with that is if you burn out quickly, you're not there for that person that really needs you to care for them. So now instead of one person going back and forth to the doctor, it's two people.
So what would be your top hints as an advocate? One was to learn about the disease or the condition.
Absolutely.
So that's number one. What else do you feel is important as an advocate?
Definitely learning about the disease and then learning about the business of healthcare. How can you maximize your appointment times? What questions do you need to ask? You need to be prepared for your appointments. What do you need to ask the doctor or therapist at this appointment? How are we going to handle new medications? How will we deal with different aspects of care? These are things that people need to know beforehand. If you see caregiving roles seem to happen gradually. At first, you just need somebody, that person just needs someone to go back and forth to the store for them or handle some banking. But once you see that, should be a signal to you that they're going to need more care, maybe in 1 year, maybe in 5. But you need to be prepared as to how to handle what's going on with them. If they have conditions now, learn about them. If you have to find out about, what doctors they have and what these doctors are for and what they're treating them for, find out. Learn everything when everything is calm. Prepare for war in a time of peace.
Tiffany, that is excellent advice and a great analogy. Thank you so much. I appreciate you being here and sharing what you wish you knew to help other caregivers avoid some of the pitfalls that can occur.
You are absolutely welcome, and I really hope that something I've said will make something easier for your caregiver audience. I really do.
Absolutely. And that is my goal, and I appreciate having you here. Thank you.
Not a problem at all. You're very welcome.